Hi.
How you doing?
Good, good.
Are you all set for today's procedure?
Yes, I am.
Great. Well, come on back. We'll go over everything, get you all comfortable.
Okay, great.
This is your change room. And so at this point, before we go back, we'll get you to sign your consent form. So you read through and sign that.
Okay.
It says that you shouldn't be driving today because you may have something called Valium, which might make you feel a little mellow. And then after you've read through and signed the forms, we'll get you to change. That blue gown ties up at the back. So take off your shirt and put your shirt in that locker.
Okay.
And then those are some tablets there, Valium. So what you do is you swallow the 2 yellow tablets with the water. And then the 2 white are an Ativan. They're like a Valium, but they're absorbed at a different rate. And what you do is once you swallow the 2 yellow, put the 2 white under your tongue and they'll dissolve quickly under your tongue.
Oh, okay.
Okay? Any questions at this point?
No.
All right, so do all that. And when you're done, just open the door. I'll come and get you, and we'll go back to the operating area and go over everything.
Okay, great.
Okay?
Thanks.
Okay. Okay, so I'm just going to draw the hairline on with you, Mark, and then we'll go from there. I'll show it to you. And we discussed in the consultation pretty much where we were going to put the hairline, so there shouldn't be any surprises. And really what we're trying to do is maintain your hairline as to where it was a couple of years ago. As I mentioned in the consultation, what we don't want to do is give you the hairline you had when you were 15. You may want that hairline, but that wouldn't look natural as you get into your 20s, 30s, 40s, and so on. The other thing is, I want to stress, this isn't a line per se, it's more of a feathered zone, because natural hairlines go from no hair to fine sparse hair to thicker hair, so that's what we'll be recreating, a feathered zone. So did you take a little time off work?
Yep. Took about 6 days in total, with options to work at home.
Oh, great. Yeah, there'll be no problems working at home, but it is a nice idea to take a little bit of time off work because what can happen is you may get some degree of swelling in the forehead, and so it'll be gone, about 5 to 6 days, but it's nice to take that time off. And we went over, you may have some little crusts or scabs on top of each graft, but they'll start to fall off again in about 7 days, and by 10 to 12 days they'll be all gone. But you have enough hair that you'll have no problems camouflaging the crusts, because you see, I'll show you the hairline, and the hair you have is camouflaging the line, so any crusts underneath of there will be camouflaged nicely. And how old did you say you are again?
35.
35. So, the most obvious area of thinning is at the front. You may have a little bit of early thinning back here, but certainly in somebody who's only 35, we don't want to start putting grafts back there because we just don't know how low you might go. So we want to conserve grafts in your permanent fringe for the front. I'm suggesting 1 session for now, and if you want to maintain hair in the crown for a longer period of time, that's why you'd want to go on Propecia and or Rogaine to really help maintain that hair, and then have surgery to beef up the front.
Okay.
Okay, so let me show you what we've drawn on here. So take a look at that hairline, and you can see that I've started just at or behind where your hairline's been to in the past, incorporating some of the fine sparse hairs that you still have. And so it'll be coming back like this, still giving you some degree of this recession, which is an appropriate hairline for males, but we'll be blunting the corners so it's not too abrupt.
Yeah.
And then we want to make sure we anticipate where you may have thinning too. So we'll be having transplanting right into these ledges here, because thinning is ultimately horizontal with the ground. So we don't want to have a thinning triangle developing in the future. So we want to anticipate thinning, certainly get grafting all through here, but also incorporate hair into here. So we'll be going through this region using 1 haired follicular unit to the front and 2 and 3 hair in the odd 3 and 4 haired follicular unit as we go a little bit further back for added fullness.
Okay.
So how do you feel about the hairline I've drawn on?
It's good. I like it. Yeah.
Good. And that would be similar to what we drew on at the consultation.
Yes. Yes, very similar.
Good. And you can see again with your hair combed forwards,
Yeah.
it'll camouflage nicely till those crusts are gone.
Great. I mean, we
So,
don't need to...
Just put your head down however you're comfortable right now. So just sort of get yourself relaxed, okay? Head down. Does your head come more comfortable to the side? Whatever you're...
Okay.
Yeah, whatever's good for you. We'll move you around, okay?
Okay.
So are you warm enough?
Yeah.
Good. So I say there's lots of breaks if you need to get up or use the washroom or anything. Okay. And those pills don't, as I say, they don't make you pass out, but they make you feel kind of mellow a bit.
Right.
Okay? So just relax there, and Andrew will be in a few minutes to get you frozen, okay? So she'll freeze the area.
Okay.
You'll feel the initial little pinpricks, but after that, then she freezes from each little spot. And then when I come in to do the surgery, You shouldn't feel anything. You might feel something going on. You
Right.
might feel pressure or coolness, but you shouldn't feel any pain. If there was any pain or discomfort, it would be very minimal, but we'd want to know about it. Just say,
Okay.
I think I feel that a little bit, so all I do is just give it a little extra feed, local anesthetic where you think you might be feeling it a little bit. Okay?
Okay.
All right?
Yeah.
So any other questions at this point?
No.
Okay. All right, so just relax there.
All right.
And I'll get Andrew and she'll be in just a few minutes, okay?
Great.
So what I normally do is give you some mood lighting there. Okay?
Great.
And I'll just see, and she'll be in a few minutes.
Hey, Mark. I'm Andrea. We're going to do the freezing, okay?
Okay.
So it's a few injections along this row that he's clipped. Do you want me to tell you before I give them to you, or do you just want me to go ahead?
Nelson, how are you feeling?
Pretty good, thanks.
Yeah, are you warm enough?
Yeah. Totally
Good.
comfortable.
All right, so Mark, as I was mentioning, we're going to check all the freezing, make sure it's all well frozen. All right, so I've prepared the area. The area is all frozen. You might feel the pressure or be aware that something's going on, but there shouldn't be any pain. If there was any discomfort, it would be very minimal, but that would be the time to let me know, okay?
Okay.
And are you feeling somewhat relaxed?
Mm-hmm.
Good. And the width here is about 1 to 1.1 centimeters wide, the distance this way. Yeah, everything comfortable?
Yeah, I don't even know what you're doing up there.
Good. Now, if we're trying as best as possible to determine follicular units and go in between them as best we can.
You guys are actually doing the incision part now?
Mm-hmm.
Well, the strip is almost out.
Oh, really?
Yeah.
I had no idea.
Okay. So, you're all stitched up and then it heals, or it's camouflaging beautifully.
Cool.
Can't even see it. Yeah. Okay. Okay. That's great. So what's happening here is everyone is dissecting the strip using microscopic magnification. First we sliver the strip that's been removed, and so this is the strip over here, which is sitting on top of ice cubes which are down below to keep the strip cool. It's important to keep the strip, more so to keep it moist while you're dissecting it into the follicular unit grafts. So this is one portion of the strip, and then here the strip is being slivered. And then after a portion of the graft, the strip is slivered, it's then further dissected into our follicular units.